Hello, everyone, and welcome to a new edition of Small Talk here in RNAO. And I'm thrilled to be here today with RNAO President Dr. Claudette Holloway and RNAO CEO Dr. Doris Grinspun. Thank you so much for joining us today.
Thank you for having us.
Thank you.
We have been at Bill 124 since the inception, saying it's not the right approach. And then when COVID came about, of course, we were at the center of it, bringing nurses even to the street, which is not something that is every day happening. And I would like our president, Dr. Claudette Holloway, to share about that, because she was in one of those rallies where we said, repeal Bill 124, and we were pleading to the Premier to repeal Bill 124.
I remember that Sunday, it was cold and rainy. I couldn't get there on time, but when I got there, it was hot on fire with advocacy to repeal that bill. So I was there to be able to join in. The media was present. They know that RNAO has a strong voice, and it's great to be a part of an organization such as RNAO that speaks out for health and speaks out for nursing. So seeing the result now with the court further strengthens our resolve to see this through and to urge the Premier not to try to repeal the decision.
We push, RNAO put on the map the internationally educated nurses. And by that, we mean not poaching nurses from other countries, but those that make Canada their home, to actually give them a fair share of working in the front lines, not on the sidelines. My colleague, friend, and mentor and leader, Dr. Holloway, is an IN. Our past president, Dr. Angela Cooper-Brathwaite, just honored with the Order of Ontario, is an IN. I am, you can feel it in my accent, an IN. And every single IN that makes Canada their home, not just a bridge to somewhere else.
It is absolutely tremendous that through RNAO, the Minister of Health sent messages to the college to expedite the process, because we have a nursing crisis while we have over 26,000 internationally educated nurses in Canada waiting on the sidelines. So through RNAO, we've been able to move the process along, and we've also made great steps and progress in having their registrations paid and courses for them. So this is absolutely wonderful.
There is more and more applicants than ever to the baccalaureate education programs. And that what we need is retention. And the government did listen to us on that. So fair is fair. Thank you to the government that did increase the seats for baccalaureate education programs.
You know, we need to develop strategies that would move nurses who are, they want to go on to be registered nurses, want to go on to be nurse practitioners. Personal support workers want to move on to RPN. We have a whole scheme that shows how nurses can process through the system. And we need that support from the government for courses and funding of courses so they can move through to strengthen healthcare in Ontario. Yes, I was absolutely thrilled years ago to be able to apply to be on this task force. And through the leadership of Dr. Angela Cooper-Brathwaite and her co-chair, Cosita Garraway, the task force has developed over 19 recommendations for systemic racism. But we want to start in our own backyard. We want to start with nursing. We know there's so much that has to be done. Nurses are from the, racialized Black nurses, Indigenous nurses have also had their personal health, their personal career affected, stunted by systemic racism. And we want to address that. We want to have our leadership reflect what is in our membership. And RNAO certainly is a shining example of that. And I'm extremely proud and humbled to be the 4th Black president of the Registered Nurses Association in Ontario.
I want to add the issues of the position statement that we issued this year on Islamophobia. That is a tragedy in our country, and the tragedy that happened in London, Ontario. I also want to mention and kudos to our rainbow nurses and our panel of experts on the best practice guidelines, because we issue a guideline on 2S LGBTQ+, and also, of course, the statement that was issued by rainbow nurses and their courage, which is very much important as we speak, with all the otherness that everybody tries to do instead of togetherness, and together we can be stronger. We did an event with all the candidates that ran for provincial and national elections, and we displayed in that Nursing Week event what it means to work across parties in camaraderie, supporting one another as colleagues in nursing, and really strengthening the profession to all political parties. And our president has participated in many of the Take Your MPP to Work, Queen's Park on the Road, Queen's Park Day.
The MPPs were so interested to be engaged, and it was so important for RNAO to give them the facts, because sometimes they don't have all the facts. And they get to understand that RNAO is working across all political parties, and they were advocating for all Ontarians, and that we do not want private healthcare. We want publicly funded, not-for-profit health.
We have a board that tells Dr. Holloway and myself, go big, go big. Go big, go big. And the bigger, the better. They are dreamers. They're dreamers that allows us to go and get big things.
We have a very passionate and knowledgeable board, a tireless board, and we have a board that wants to do the best for Ontarians and healthcare nursing. And we want to remind everyone that the board members and myself, we are volunteers. So in addition to the workload, and I think also of our past president, Morgan Hoffarth, managing long-term care and still devoting time. So with this kind of passion and power, we're going to move forward and do big things for nursing and healthcare.
Whether it's Una Ferguson with ODSP and the terrible situation of having people that are suffering disabilities.
I want them to sort of like realize that, that we are in deep poverty. In 1998, we were getting $936 for rent and for our basic needs. And 24 years later, we're getting $1,160. That's only a $232 increase for over a 12-year period.
Without groups like RNAO and others that push for the double the rates, probably even the 5% would not have happened. So, of course, 5% is not enough when COLA is almost 7%, and Scott will continue to suffer the humiliation of low rates of ODSP. But you have a president in Dr. Holloway that doesn't give up very quickly. Look at what all the interest groups and the chapters are doing, and we are a force to reckon with. Look what nurse practitioners have done this year in terms of the knowledge exchange, in terms of the symposiums, in terms of the monthly, bi-monthly meetings. Look what psychotherapy nurses have done and the mental health nurses that we met with Minister Tivolo. Look what we achieved this year, 50,400. Let's get to 60,000 by the end of the year of 2023, because it's a lot more that will be accomplished with a strong voice.
So we've got a 100th anniversary coming up, and by then we really want to go to the moon and back with our numbers, with our advocacy. So join us. You will not regret it. You have so many benefits that will advance your career, that would keep you learning and on top of all the issues that we're trying to address. So we need every single one. So if you haven't renewed, please renew, please rejoin, and please join.